In the last video, Shona explained why activity management and pacing yourself is important for managing your pain. So, how do you go about managing your activities in a different way so that you can gradually do more of the things that matter to you? When we look at the different strategies that you can use, you may find it helpful to think of the 4 P's. That's prioritise, plan, pace, and problem solve. The first step is to prioritise. Some things are non-negotiable and just have to be done, but others may not have to be. I like to ask myself, can it be delayed, delegated, or dumped? It may be time to re-evaluate the things that you've always done and how you go about them. For example, you may be someone who's always ironed your bedding, but now decide not to spend valuable time doing this anymore. Re-evaluating your priorities can be hard, but can also make a massive difference in terms of managing your pain. The next step is to have a plan. Initially, it can be helpful to record everything you do for 1 week, as in the picture on the slide, and then look at what you did and ask yourself some questions such as, did you feel that you had a good balance of activities over the week? And did you include things that you enjoy? Once you've asked yourself these questions, plan out the next week so that you balance things more as you'd like to. Remember to take into account not just the physical side of what you do, but also the emotional demands and how much brain power different activities take. And don't worry if something unexpected happens despite your plan, and you have to adapt accordingly. And now to pacing. I'm sure you'll have heard the term before. It's a really important tool for managing pain. It means going about things in a different way so that you take control over what you do rather than being controlled by your pain. Breaking tasks into manageable chunks and deciding beforehand when you will stop or change activity or position is key to pacing yourself. The aim is to be consistent in what you're able to do each day, setting yourself an achievable baseline that you can manage on both the days when your pain is bad and the days when you feel relatively good. This means that you have a starting point from which to build up the amount that you can do. Think of the tortoise and the hare. An important part of pacing is, therefore, the concept of using a baseline, and I'll explain this a little bit more. Setting baselines means agreeing with yourself how much of an activity you will do so that it will be manageable and can be carried out consistently. The best way to establish a baseline is to look at what you can manage on good and bad days before the pain tells you to rest or change position. Then set your baseline somewhere between the 2 levels, closer to the amount that you can do on a bad day, so that it is always manageable. For example, Julie established that she's able to walk for 15 minutes on a good day before her pain increases, and about 8 minutes on a bad day. She therefore set her baseline at 10 minutes. Once she'd managed this each day for a week, she increased her baseline by 10% to 11 minutes. After a few months, Julie was able to manage 20 minutes of walking on a regular basis. Initially, it can be frustrating to limit yourself on a good day when you feel you could do more, but stick with it. It does work over time. And the final P is problem solving. It's important to review how things went and check whether your baselines need altering up or down. And remember to give yourself some credit for the hard work you've put in. In conclusion then, here are the 4 P's again. Prioritise, plan, pace and problem solve. Although we know this may all sound like common sense, we also know that changing habits and behaviours can be difficult. We'd like to challenge you to experiment with doing things a different way over the next few weeks. This will help you to establish whether or not these will be useful strategies for you at the moment to help to manage your pain.